discussion now. The South African Human Rights Commission has concluded its week-long visit to Limpopo. The purpose of the visit was to look at the state of human rights in the province. Joining us now is South African Human Rights Commissioner, Advocate Sandra Makoasha. It's great to talk to you. Thanks very much for coming on. So that's quite a broad stroke statement, right? To look at the state of human rights in the province, Advocate Makoasha. What prompted this visit by the SAHRC?
So as part of the human rights, once again, good afternoon to you and your viewers. In terms of the Commission's monitoring mandate, what we normally do as national commissioners, we build up on the work that has been done by our provincial officers throughout the year. What the need for the provincial visit in Limpopo is started from strategic issues that we've noticed, specifically in the health sector. So as part of our monitoring, we started there and moved forward to meeting with MECs. But the center of it was, as the Commission, we needed to have political discussions around systematic issues that we noted in the province.
Yeah, and there are many, right? And our headlines are full of them week after week, from education to the healthcare sector. But what stood out for the Commission?
What stood out for the Commission was, again, the healthcare sector and the state that it's in, high levels of vacancy, depleting infrastructure, as well as not only that, but lengthy queues that elderly persons have been. We noted, we had an elderly person who advised us that they've been in the queue since 7 o'clock in the morning. And when we went to the source of it, it's the first thing that we noted is poor record keeping of the medical records of these patients, which often results in lengthy queues and opening new files. And we asked them, you know, what is the point of opening new files when you could just have proper record keeping? We met with the MEC, who committed herself to ensuring that the issues of the record keeping are dealt with. This is something that can be dealt with in terms of administration. We noted the high vacancies in the healthcare sector, especially in Limpopo. We had a 69 vacancy rate in one of the psychiatric hospitals that we monitored on Monday in High. But we also noted in some of these instances, especially in the psychiatric issues, it's that there are beds that are occupied by patients that could be released to their families, but due to the stigma attached to mental health or mental illness, they were not welcomed in those families. So I think that is something that we need to look into around how do we have conversations around removing stigmas around mental illness so that they are back into communities and that those who need help have available beds to them. So we are quite impressed by our meeting with the MEC. We're hoping that the deliberations we had on Monday have outcomes that are better for the community, and we wait for the written responses from the MEC as well.
Yeah, and actually that was my next question to you. You say you're heartened by the response by the MEC, but there have been previous Human Rights Commission reports on service delivery issues, not only in Limpopo, but in other provinces as well. When you do these visits, in this case, it was a week-long visit to Limpopo, is there a follow-up on previous recommendations from the Human Rights Commission and the work that's been done there?
Definitely. So in respect of our monitoring exercise in Tilizini, this is based on a follow-up visit based on Commissioner Boshov's provincial visit in November. And we highlighted some of the concerns, such as, again, infrastructure issues, vacancy issues. But we also then had questions about the opening of the maternity ward and the neonatal ward. And when we arrived there, we were advised by the MEC that the maternity ward is operational and is working. However, what we are going to do as the Commission, we have declared that Tilizini will be a hospital of interest to the Commission, given the infrastructural issues we've seen, but also a number of complaints that do arise from that particular hospital.
Yeah, it does feel, in a sense, and I imagine even more so for residents who are impacted by these kinds of service delivery issues, particularly in healthcare, that we go around in circles with these kinds of visits and reports, right? Is the Human Rights Commission keeping track year after year of the kind of progress we're making and whether it's enough?
We are
Advocate
keeping
Makoasha?
track of the progress that we're making, for example, in respect of the water and sanitation issues. Yes, I'm still here.
Sorry, yeah, there was a delay.
Can you hear me?
There was a slight delay in you coming on air, but please go ahead.
So, for example, in respect of the monitoring of what the work has been done, in terms of the water and sanitation issues that we've raised, as well as our report, we were monitoring that. We are following up in some cases, such as the Vemba district. We will be instituting legal proceedings against them. In one of the other municipalities, we are currently in court regarding their failure to adhere to our recommendations. And this is based not only on our report and recommendations, but it's also follow-up monitoring and engagement with the respective municipalities. But I think what is important is earlier today we've met with the Speaker of the Legislature, who then advised us that they will be opening up their doors to the Human Rights Commission to table our annual reports on the state of human rights in the province, but also to hold the respective departments accountable through collaboration to ensure that at the end of the day, our reports are tabled and there is some follow-up, not only from the Human Rights Commission's perspective, but from the provincial legislature, which we've seen amazing results taking place in the Eastern Cape as well as the Free State, the involvement of tabling this before legislature.
Yeah, it's so incredibly important for all of us to keep track of these kinds of processes, particularly when we live in the communities that are underserved. Many communities like that exist in Limpopo. So we've talked through water and sanitation, we've talked through healthcare. What about the functionality of equality courts in Limpopo?
What we've noted is there has been an underwhelming utilization of equality courts, and at the center of it is that there is poor education amongst community members of the existence of the equality courts. There's lack of training of magistrates as well as the clerks of the equality courts, infrastructure that is not available to support the equality courts, lack of signage that is there for members of the community. It was quite concerning for us as the Human Rights Commission, given the systematic issues in Limpopo specifically around issues of hate speech, inequality, that these courts are underutilized due to a number of issues. Once we did the monitoring of the Mangweng and the Zanin equality courts, we met with the chief magistrate, who then said, look, we can collaborate to provide training to not only the magistrates, but to the clerks to ensure that persons utilize them. We also advised them that the office of the commission in the province is open to offer service, not only to support the complainants, but to offer its mediation services to those magistrates that are unable to adequately deal with those matters.
Yeah, it's so incredibly important. Can't be overstated how communities, all of us, need access, real access to not only equality courts, but other forms of justice as well. So, Advocate Makoasha, before we let you go, just as an overall state of human rights in Limpopo, does the South African Human Rights Commission have a sort of 1 to 10 scale of how you would generally rate human rights?
In the province of Limpopo, we're rated as a 4, given the number of systematic issues on the ground. And we're hoping that in collaboration with the stakeholders, as well as the commitments made by the respective MECs as political heads, that once we come back and we have to give a score, we're hoping that the score is at least a 6. But I note that the people of the Limpopo province often, when government fails them, they often take steps into their own hands. You'll see inspiring stories of community members building bridges themselves, So I think that we are saying that we don't want members of the public to take, to act as service delivery institutions, but we want them to enjoy what government is supposed to do. Therefore, as the Human Rights Commission, we'll continue to monitor the observance of human rights. And we hope that these discussions we've had and the resolutions we have arrived at have a positive outcome to citizens of South Africa. We will also ensure that we are far more visible than we are right now. That is a criticism that we received on the ground. Therefore, in the next year or so, we will be more visible, engaging with communities to ensure that at the end of the day, we give them a better scorecard in respect of the observance of human rights.
Thank you for acknowledging that, and we're going to hold you to it over the next year. Thank you for your time. Advocate Sandra Makoasha is with the South African Human Rights Commission, a 4 out of 10 for access to human rights in Limpopo.